So thank you for the invitation and the introduction for the conference today. The work I'm going to present is some of the work from my postdoc, interested in how changes to muscle fascicle length and muscle architecture influence function in aging muscle, specifically passive force. So natural adult aging is associated with age-related muscle weakness, and this manifests as impairments in whole muscle performance. And as you know, there's a variety of factors that contribute to this impaired whole muscle performance, such as a loss of contractile muscle mass, okay, as we can see here in the young, old, and very old panels on the bottom of the screen, young being 25 years of age, old being 65, and very old being 85. But something that's even more obvious than the loss of contractile muscle mass is this infiltration of non-contractile tissue, including collagen, various levels of fibrosis, and intramuscular fat. Similarly, reductions in activation impair force production capacity, and this can be due to a reduction in the fidelity of the signal from the brain to the contracting muscle, as well as impaired excitation contraction coupling. I'm thinking at the whole muscle level, muscle architecture, so reductions in fascicle length and pennation angle, with doctors Narici and Franchi have published on extensively impaired force production, as well as more recently alterations to the architectural gear ratio can influence dynamic performance as well as power. And all of these factors contribute to reductions in specific strength or muscle quality. So when the force production capacity of the muscle is normalized to the available excitable muscle mass, there's still reductions. One factor that has seemed to have received less attention is age-related alterations to passive force. And a review published last year by Marcucci and Reggiani, one of the things I took from that review is that there's considerable variability in the literature regarding passive force and changes with age. One thing that's fairly consistent is at the whole joint level, there's an earlier increase in passive tension for a given joint rotation. And then moving through various levels of muscle hierarchy, the picture becomes a little less clear. At the whole muscle level, it's an excellent model to investigate passive force independent of voluntary activation involving a muscle and musculotendinous unit. And then getting down to the cellular single fiber level and bundle level, this is another level at which to explore how various mechanisms contribute to age-related alterations in passive force. But one example I'll point out regarding the variability is two studies on skinned single fibers. One from Lim in 2019 out of Frontiera's group showed that there was an increased passive tension in a length-dependent manner for old as compared with young single fibers, and this was consistent across fiber type. Out of our group last year, Alex Noonan, under the supervision of Dr. Steve Brown, showed a length dependence of passive tension, except this occurred between around 2 and 3.5 microns. So there was an earlier increase in passive force in the single fibers from old, okay, compared with young, and no age-related difference at longer lengths. Like I said, I'm interested today to talk about muscle architecture and how that might influence the often observed increase in passive force at the joint level. So with natural adult aging, it's pretty consistently shown that older adults have shorter muscle fascicles as compared with young, and this can influence the active force length relationship. So when we move about and interact with our environment and locomote, we're moving in absolute sense, not normalized length changes. So while these single fiber and bundle and muscle studies do an excellent job of normalizing length changes, that's not necessarily how the older adult will be interacting with the environment and suffering, or maybe suffering is not the correct word, but incurring these differences in length changes. So taking an older fascicle and stretching it 1 centimeter and a young fascicle and stretching it 1 centimeter could possibly position those sarcomeres on different portions of the force length relationship. So for example, if we were to take a young fascicle and stretch it 1 centimeter, perhaps it would land, the sarcomere length would end up on the plateau, while the old fascicle would end further down the descending limb. So the purpose of this study was to investigate the medial gastrocnemius of young and old rats to determine differences in fascicle length, serial sarcomere number, and the sarcomere length at the optimal length for force production, and record passive tension from short to long muscle lengths. So in other words, to try to understand whether age-related shortening of muscle fascicles can contribute to the elevated passive tension often seen during earlier joint rotations. So the hypothesis was that old would have shorter fascicles compared with young. I don't think this is too striking of a suggestion, owing to fewer sarcomeres in series. Sarcomere length at the optimal length for force production would not differ between groups, and passive tension would be greater in old as compared with young at long muscle lengths, owing to this greater relative stretch. So the experimental setup we used to address this question, we used Fisher 344 brown Norway rats obtained from the National Institute of Aging. And this is regarded as one of the best animal models of musculoskeletal aging because these animals can age up to very old age without incurring a lot of the confounding factors such as tumors and cancers, which other inbred animals incur. 7 to 9 months was chosen as this represents roughly a human age of 20 years of age. And we were interested in studying the effects of aging, not maturation, on function. So we could think of these animals as roughly 20 and 75 years of age. This was an in situ preparation. So the skin was carefully retracted and formed in a tent. We poured oil in and heated to 36 degrees Celsius. This maintained muscle temperature. The medial gastrocnemius was carefully dissected from all other muscles and tied in series with the force transducer at the tendon. So we had a suture tied around the calcaneus, and this was tied in series with the force transducer. A bone pin was inserted into the tibia and a clamp placed on the femur attached to the stereotaxic frame to provide rigidity. There was a nerve cuff implanted on the sciatic nerve, and all nerve branches to other muscles were cut in order to have only the medial gastroc activated. Optimal length was determined with tetanic contractions. So a series of tetanic contractions were performed in order to identify the optimal length for force production. Once optimal length was determined, the muscle was then stretched or shortened by -4 millimeters to +4 millimeters, including the reference length. So a total of 9 different length changes. Following stretching or shortening, the muscle was given 2 minutes to relax from stress relaxation before we recorded the passive tension. Following experiments, the muscle length was returned back to the optimal length for force production and then fixed in a bath of formalin for 2 weeks. Following fixation, the muscle was sectioned into 4 lengthwise pieces, and 5 fascicles from each lengthwise piece were dissected. It's represented right here. So then in order to determine sarcomere length, the fascicle, we use laser diffraction on 5 points along each fascicle. So in total, per muscle, there was 100 sarcomere length measurements. And what we found, in line with our hypothesis, is that old rats had shorter muscle fascicles than young, and this was owing to fewer sarcomeres in series. So each 3 of these panels are presented similarly, the young in black, the old in white, and the variable of interest on the Y. So there's a 14% reduction in fascicle length in the old as compared with young. There was a 4% reduction in sarcomere length, which did not reach statistical significance, but will come up again in our discussion. And there was a 10% reduction in serial sarcomere number. So the age-related reduction in fascicle length appears to be driven by the reduction in serial sarcomere number, not necessarily sarcomere length. Again, in line with our hypothesis, passive force is elevated in muscles from old rats at long muscle lengths. So muscle length along the X and passive force on the Y. We saw a separation by 3 millimeters, but by 4 millimeters of absolute length change, there was a 125% increase in passive force. And we expect this would continue with increasing excursion. So then the question is the reduction in serial sarcomere number driving this? So we know the animals have shorter fascicles. We know this is owing to fewer sarcomeres in series. So for the same absolute stretch, are those fewer sarcomeres experiencing a greater length change? So what may be contributing to elevated passive tension? Is it the potential for overstretched sarcomeres? Well, with this 4 millimeter absolute stretch, that resulted in a 30% lengthening of the young fascicle and a 36% lengthening of the old fascicle. However, this 4% reduction in sarcomere length is coming back into the picture now because this seemed to have buffered any relative difference in the fascicle excursion. So at the end of stretch, at the end of that 4 millimeters of stretch, sarcomeres from both young and old were stretched to approximately 3.01 microns. So despite having shorter fascicles, there was no overstretching of the serial sarcomeres in old, and that would not be contributing to the elevated passive tension. So this would indicate that titin and other load-bearing proteins are not stretched more in old than young. So the collagen matrix likely remodeled its slack length in the old, resulting in greater strain than the young when stretched to long muscle lengths. So back to some of this skin fiber data in humans. One of the themes I'm trying to get across here in this presentation is that there are likely multiple structural mechanisms contributing to elevated passive tension throughout the muscle's excursion. So when we're trying to identify reasons for increased passive tension at the joint level, there are likely other factors at lower hierarchical levels that could also be contributing. This skin fiber setup from Alex under the supervision of Dr. Steve Brown, like I mentioned, he showed a length dependence from 2 to 3.5 microns. And so what this likely indicates is that at the single fiber level, void of the extracellular matrix and collagen content that's bearing most of the passive force at higher hierarchical levels, titin and other proteins could be driving some of the age-related changes in passive tension. And this is something we're continuing to investigate. So some current work in our lab is we're looking at remodeling of muscle and changes in collagen content in the context of non-pathological sarcomerogenesis. And what I mean by that is increasing and decreasing the number of serial sarcomeres to increase fascicle length and decrease fascicle length, independent of disease or pathological conditions. So we have animals running uphill and downhill on treadmills, and we've already shown that this is an effective stimulus for increasing and decreasing fascicle length owing to an increase in serial sarcomere number. So this work is being led by a student in my lab, Avery Hinks, in collaboration with Dr. Martino Franchi. And I think one of the really big questions now in our area is remodeling of sarcomere length occurring with fascicle length changes? So it's fairly easy to observe with muscle ultrasound changes to fascicle length, but what's less clear is what's contributing to those length changes. Is it the addition and subtraction of sarcomeres in series? Is it deposition of non-contractile tissue? Or is the sarcomere remodeling its length to accommodate this new condition? The latter, I'm not entirely sure about it, as mammalian muscle does an excellent job of highly regulating optimal length for force production. But these are some of the questions we're currently working on in my lab. So with that, I'd like to thank the conference and for being invited, as well as pointing out that the old animal data were collected at the University of Calgary during my postdoctoral fellowship. So thank you very much. I'm happy to take any questions.
Thank you very much, Dr. Power. I really enjoyed your talk. And, in fact, congratulations for your work. Which I happen to referee, so I actually liked it. So now the floor is open for questions.
I can ask a question.
Please, Feliciano.
Can you comment on that reduction of 4% in sarcomere length? I mean, people that study assembly of sarcomeres knows quite well that, for example, I don't know, the length of the thin filaments is controlled by nebulae, or the assembly of myosin in thick filaments is controlled also probably by titin. How do you see this shortening happening?
So actin length in the rat would be 1.09 roughly. So I don't see actin length changing necessarily, and we haven't measured that in this model, but I highly doubt that that's driving any of these reductions in sarcomere length. One thing that's coming to mind, and we speculated on a little bit, is the fact that with age you're losing myosin content. So we don't know if the shortening of the sarcomere, which was determined by the optimal length for force production, is an artifact of trying to obtain more overlap to maximize the number of cross-bridge attachments. Now that's highly speculative. on my part, but that was the only non-structural reason I could think of as to why we would show shorter sarcomere lengths.
Yes. Okay. Thank you. Thank you.
Very interesting question. Any more questions?
Maybe one question. I think this is a great example of a great model. And, you know, exercise would be great to show changes. I think that's the first step. Have you thought about exercise plus, you know, potential compound and anti-aging compounds like, you know, the NAD precursors are a hot topic right now. And have you thought about some combination in the future that you might study?
Yeah, that's a really interesting point. I haven't actually considered that at the moment, but you know, that, you know, reducing reactive oxygen species through exercise and all these other factors do seem to contribute to muscle health and age. So that's definitely a route to look into. Currently, we are also doing a mobilization. So kind of, you know, we're looking at the two ends of the spectrum. So exercise, eccentric and concentric, as well as a mobilization at short and long lengths to tease some of these factors out. But thank you for that suggestion.
That's cool.
Yeah, very exciting. Thank you.
Very short. What about the model of bone and muscle lengthening, which is the opposite of your observation? Is this still surviving the idea that the sarcomere are added at the end, or it is a random process? And the same in the shortening. Is it a random process, or it is at the end, at the muscle tendon interpretation? You have some information, some new data in literature? I am lazy.
Yeah, that's definitely in line with our thinking, is the regionality of muscle hypertrophy and where sarcomeres are added following use or disuse. And I think there's some speculation that following eccentric training, there's increased sarcomeres at distal ends, so where the most mechanical tension may be exhibited. We have been trying to be a little more careful with our measurements along the fascicles. So with our current studies, we're obtaining more fascicles per muscle from deep, superficial, lateral, and medials to try to get a good representation of where the sarcomeres may be added in series. So hopefully we will have some of that data following the next series of investigation. But if I was to guess, I would say with most of our models of eccentric training and casting at long lengths, we would see the addition distally towards the tendons.